Hi everybody, it's Kika, your lifestyle blogger, and I am here today to talk to the professionals that are in healthcare, senior living. I want to talk to you guys today because I want to talk about this thing called partnership, which is very important in this day and time, especially since COVID happened. You know, our whole world was turned upside down when COVID happened. And that had a real big strain on a lot of relationships in business and in personal life. So, what I want to talk to you today about is a partnership that you can create to be as successful as you were before COVID. So, let's talk a little bit about that. All right, I'm back. So, healthcare professionals, there's all kind of ways that I can go with this conversation, but I'm going to keep it short and simple. And we're going to talk about your relationship with home health professionals. And I say home health professionals because I work in home health. I am a sales manager for Canute Nelson, so I just want to put that disclaimer out there. I've also worked as a sales director in senior living for over 20 years. So I do understand what it is to build relationships and partnerships and ensure that we are working seamlessly together. And that is what this video is all about. So let's get into it. Let's first start by talking about the myths. And I want to talk about the myths because I think they are very important. Now, we all know that we are in the business to gain referrals, right? So the biggest things about the myths that you need to know is that we are in it to really, truly work together. Patients and families love continuity of care, and in many cases, they don't see us as two separate entities. They see us working together as one seamless entity. And because of that, we want to make sure that our communication is impeccable. And one of the ways that we do it, and I am a fan of, is what we call care coordination meetings. And you're probably sitting back and you're wondering, what is a care coordination meeting? Or you may be sitting back and say, hey, I do those often. Well, let's talk about how care coordination meetings are helpful when you are working in a team aspect, when you have two companies working together seamlessly to provide care to an individual. So they're both looking at us as their primary care providers, right? They probably don't see us as two separate entities anyway, because you have a nurse, we have a nurse, you have caregivers, we have caregivers. We may be in different attire, but we all function in the same capacity. Now, as long as we agree with that, then that leads me to my next part. So in healthcare, a lot of things gets confused when there is not seamless communication. And what I mean by that is sometimes when a home health agency is coming into an assisted living facility to care for a client that we received a referral on, we want to make sure that we are speaking to people coming in the door and we're speaking to people when we leave the door. And the reason being is because there may be updates or a situation that happened with a particular client before we got there that we need to discuss and talk about so that we are all on the same page. And equally, when we go in and we take care of a client, something may have happened during that session that needs to be talked about with that facility staff so that we can ensure that we are all on the same page. But we know that during the day, we're really busy, right? You may be in with a client as well as the home health is in with a client, and there may not be an opportunity to connect. So what we do in that case is we have care coordination meetings. These meetings can be short, simple, and sweet. All you're simply doing is saying what you provided for that client for the week. And these are the clients that you have in common. So you're going to talk about that, and then that way you'll be able to know what you may need to do next when the time comes that you need to go and see the client again. However, in most cases, some assisted living facilities do have a little bit of a hesitation on working with home health agency. Now, I was talking to a friend the other day, and she has worked as an executive director for many years for an assisted living facility, and she was not sure about homebound status. She wasn't sure what that meant, and she had some questions about it and wondering, how do they get all those things paid for at 100%? She was so focused on the care that they provide at the assisted living facility that homebound status wasn't even a subject. She did not know that they could get care from a home health at 100% coverage, which would have saved so much money and so much time because that person would have been able to live at that facility a lot longer. But instead, because she didn't understand the partnership that could take place between the facility and the home health provider, that client had to discharge and go to a nursing home. And that nursing home took that client, but that client and their family was not happy at all. Had we worked together, we could have saved that client and that family a lot of heartache and heartbreak, and they could have lived in the facility much longer and probably would have never had to move. So let's talk about why a partnership with home health care is key. If you want to keep your residents in the facility for longer and not have to worry about frequent flyers to the hospital or losing them when they're in the hospital to another company, you want to partner with home health because your home health can be a saving grace in that situation. One of the big things you should know is a home health care, they come with a fabulous sales team. Now, this is not just a ploy because I work in home health. I'm just telling you this from my years of experience. But having a home health sales professional, we're always out and about in the community and in the hospitals and in TCUs and seeing our clients. We want to make sure that we get them back. So if they live at your facility, we want to make sure you get them back too because you work with us. So we would be your eyes and ears at the TCUs, at the hospitals. The most important thing of all of this, for this to work seamlessly, is for you to work with us. And the way you do that is when your resident goes to the hospital, it is very important that they go with the information to knowing who their home health provider is and where they live, because we can go in and visit them in the hospital and ensure that they come back to you. So you'll want to equip that information right away when you're having discussions with the hospital and the social worker. You'll want to tell them who you're using for a home health provider. And then that way we can be your eyes and ears at the hospital. We can even continue our care coordination meetings just to give you updates on those people that are in the hospital, and you can provide us with updates as well. So that way we can ensure that we get our people back. And I say our people because it's yours and ours. We're working together to make this happen.